When someone says you fight like a girl, it's not meant as a compliment, but when it comes to breast cancer, women can throw and take some tough punches. Tonight, we begin a special series in honor of Breast Cancer Awareness Month. All week, you'll hear stories from women right here in the Miami Valley. But first, we hear from some of the doctors and specialists.
It's such a earth-shattering diagnosis for a woman to hear.
The women at Miami Valley South's High Risk Breast Center use their minds, skills, and hearts to battle breast cancer.
Mammography saves lives, and women save each other.
Hang on to the last part of what she just said. We'll get back to that in just a moment. But first, mammograms. Radiologist Patricia Brining says they're still the best way to find breast cancer early. Mammograms can sometimes find the disease up to 3 years before it can be felt.
Mortality decreases by at least 40%, if not greater, in people who have yearly mammography.
Sticking with 40, that's the age she recommends women with a normal risk begin yearly mammograms. The process takes about 20 minutes, and she says it's relatively painless. About 10% of cases of breast cancer involve an inherited component. A genetic counselor like Julie Sawyer can help identify a family's risk.
And we can actually run calculations that will give us an idea statistically what the chances are that they could carry a gene that's changed in such a way that it raises the risk for breast cancer and ovarian cancer.
The gene mutations are called BRCA1 and 2. Sawyer says men can also be carriers, so a father's family is just as important as a mother's when evaluating risk. Women with a mutation have up to an 85% risk of developing breast cancer.
We talk about how a woman would feel in various circumstances and various results so that she isn't blindsided, so that she has a chance to decide if that's even really something she wants to know at this point in her life.
Surgeon Melissa Rowley says treatment for breast cancer is so individualized and encourages patients to take their time in understanding the diagnosis.
It's okay to just take a few moments to learn as much about it as you can, to understand what the disease is, to talk to people, to spend some time talking to the doctors.
A woman can have the lump removed, called a lumpectomy, or remove the entire breast, called a mastectomy. Dr. Rowley says the survival benefit is about the same.
There's a slightly higher chance that a woman who has a lumpectomy with radiation will have a recurrence. Now, it's not 0 in women who have a mastectomy either. It's still of about 5%.
She says in her practice, she's seeing more women who develop cancer in one breast opting to remove both breasts to reduce their risk of reoccurrence. She says reconstruction is an option for many. And returning to that comment about women saving each other, well, we just may be our best ally in the fight against breast cancer.
People don't take the time to take care of themselves, and sometimes you need to grab your sister or your best friend or your mother and come in and have your study together. And we see groups of sisters or friends who come in and they make a day out of it. And that's kind of a fun way to do it, because then you don't forget every year. And then you've got your bosom buddy with you to help you go through it.
Absolutely. Everybody needs a bosom buddy, and we have much more for you as part of Breast Cancer Awareness Month. Every night this week, we will hear the inspiring stories of survivors from right here at home.